ZUMA was the first multi-center trial to be done, nationally or internationally in CAR T cells in aggressive lymphoma patients. So prior to that, patients had been treated on individual trials, at different centers. But ZUMA-1 came up by Kite Pharma company, and they were the ones to kind of do the biggest sort of multi-center trial first. So ZUMA-1 was a phase 1-2 trial of about 100 patients with very aggressive diffuse large B-cell lymphoma, very refractory disease, like patients who are progressing to their last line of therapy. So very sick, very difficult to manage patients who would unfortunately be dying very soon if we didn't do anything about them. The ZUMA-1 CAR T cell product is also a CD19 directed CAR T cell product, but compared to Juno, which contains something called 4-1BB, which is a co-stimulatory molecule or domain in the construct of these CAR T cells, the ZUMA-1 construct, or the Kite Pharma construct, does not have this 4-1BB, so it's just a CD28. It's something called CD28 co-stimulatory, which the Juno one also has. So the products are a little bit different, and what we saw with the ZUMA-1 trial, which has much longer follow-up of patients compared to the Juno trial, was that there seemed to be about there's already a longer follow-up, so about 1.5 years now, that is going to be reported as well tomorrow morning, the same time as the Juno results are going to be reported, but Monday morning. But it seems that, and just by our own experience, most patients have had much higher toxicity, have had a lot of CRS, cytokine release syndrome, and a lot of neurotoxicity side effects. But pretty much all of these, or most of these, are reversible. So they have a rocky course in the first couple of weeks. They need to be in the hospital, etc. But when the dust settles, everything settles. If they go on to have a response, if they hold on to their response for 3 to 6 months, they tend to stay in a remission durably, which is kind of what you want. So people who may have been dying within weeks are now living for 1 year or 2 or more, potentially. That's how far they've been followed so far. So we don't know how long they'll stay in a remission. We hope it's a cure, but we don't know that yet. So just to summarize, the ZUMA-1 trial, 100 patients, very refractory and very aggressive diffuse large B-cell lymphoma patients. Lot of toxicities seen, manageable, reversible, but also about probably 50% of them are staying in durable remission.